It's truly amazing how far we have come. And equally amazing is the thought that the next 50 years promise to deliver an even more exciting era of medical discovery. If the rise of NCDs is not reversed, we risk losing progress in health and economic development. Working together, we find synergies and convening powers. Talking to the industry as a whole rather than just individual companies makes life easier for our partners in developing countries. We are willing to take risks in promoting partnerships, champion positive outcomes, and demonstrate that this industry is willing to be a solution partner.
We're going to look at how health systems can better respond to global health threats.
Interaction is extremely important because we know the alternative doesn't work.
The threat of new and emerging diseases, with their massive economic, social and political disruption, is ever present. The pharmaceutical industry is a crucial and intrinsic part of the global health architecture, and our partnership is absolutely essential to reaching our collective goals of improving global health. The strongest and most sustainable partnerships are those designed for impact and aligned around common interests. Industry needs to continue to do what it does best, to innovate, to bring the safest and most effective products to licensure and to market at the scale required, and to create value.
Diseases know no borders. Governance and governments must plan differently. We can invest in the very people that we are trying to help. That is more sustainable. The private sector is already front and center of the UHC agenda. I don't think there's many countries that can achieve the UHC agenda without the private sector.
What does it take and what we have found? How much does it cost to be prepared? And it turns out it doesn't cost that much. There is really strong case for the government to finance it appropriately as a public good.
The global health security is the service of ensuring that people have the ability to protect themselves and to live healthier and more productive lives. It's really been encouraging to see the way in which the relationships between the private sector and the public sector have evolved for over a quarter of a century. Having a strong primary healthcare system, there's adequate infrastructure, trained healthcare workforce, the right level of leadership, and those are the common foundational elements of both a strong response for global health security and for universal health coverage.